As an FJO practitioner myself, one of the few difficulties that I come across is when a patient's already been to an orthodontic specialist in my area, and they've already been given the opinion that maybe teeth might need to be removed, and they haven't really had it instilled in them that there may be some kind of problems with the jaw joint or with the palate and other things that we talk about. So why is it that often, or in some cases, an orthodontic specialist might think this way?
I think it really goes back to how that orthodontic specialist was trained and where they were trained. One of the things we see around the world is an increase in the number of practitioners who are now practicing functional jaw orthopedics, but in the role of the specialist who possibly has only been exposed to one technique, and they're thinking they're doing the best for their patients because that's what they've been trained to do. That technique may not offer the choice of development of the palate. I see a number of patients who come to me for a second opinion who've seen highly trained specialists have only offered them one path, and I think when parents understand there are options available for their child, they can see the common sense in trying to avoid removal of teeth where it can be avoided.
Mm-hmm. Okay. So do you think the same sort of problems exist the world over, or is there a difference geographically in the way orthodontics is taught postgraduate?
There are places in the world where you see a combination. I think some of the best orthodontics in the world is currently being practiced in Brazil, where they teach a formal program in functional jaw orthopedics, followed then by a program in orthodontics. So those practitioners have the ability to do the early treatment and finish the case well. Mm-hmm.
So they have a balanced view basically, because they've been
correct.
Taught from both aspects.
Yeah, and I would say that things are changing. I see the changes occurring worldwide, but in answer to your original question, I would say that whoever calls the shots at the dental school is probably the person that would greatly influence the curriculum and what is taught. And as we see dental schools acquiring new heads, people who may be a little bit more open in their approach, we're slowly seeing those changes occurring.